Hello and welcome back. My name's Mr. Abasa Glory. So thank you for joining us here, and thanks for everyone for subscribing and for following up. So let's go straight to the first question we have, and then let's see the rationale behind such a question. Now the question says, a female client complains of chest tightness, wheezing respiration and palpitation. Shallow rapid breathing are noted. Shallow rapid breathing are noted. Which of the following priority actions should the nurse do first? I repeat the question. A female client complains of chest tightness, wheezing respiration and palpitation. Shallow rapid breathing are noted. Which of the following actions should the nurse do first? A. Notify the physician. B. Provide oxygen therapy. Number C says have the client breathe into a brown paper bag. And number D say administer anxiolytic medication. Now the first question we're going to ask ourselves is, what is the question asking us of? What is the problem that we have in this question? Now the question says the client complains of chest tightness of the chest, wheezing respiration and palpitation. All of these signify that there is a respiratory issue. Shallow rapid breathing. Number one, we have tightness of the chest, wheezing respiration, shallow rapid breathing are all signs of respiratory problem. Now, the big question is, which type of respiratory problem will the patient have that will present these signs and symptoms? Now, we know for sure we have pneumonia, we have tuberculosis, we have asthma, we have bronchitis and all that. Now, one major thing that signifies or differentiates asthma from every other respiratory distress is wheezing respiration. So it therefore means that this patient is having wheezing respiration, or rather having asthma. This patient is having asthma. It means the patient is having asthma. So when a patient is having asthma, the question is, which action should the nurse do first? 1. Notify the physician. When a patient is having asthmatic crisis, is it notifying the doctor will be the first thing to be done by the nurse? Let's hold on. Number 2, provide oxygen therapy. Should that be the first thing the nurse will do? Let's hold on. Number 3, have the client bring it to a brown paper bag. Should that be the first thing the nurse have to do? Let's hold on. Administer anxiolytic medication. Now, let's now analyze these options and ask ourselves, when a patient is having asthmatic attack and having rapid, shallow, rapid breathing, we know for sure that during asthma, there is bronchodilation or bronchoconstriction. In asthma, there's bronchoconstriction. And when there's bronchoconstriction, it means that oxygen is not entering the lungs, enough oxygen is not entering the lungs, and we have more retained carbon dioxide in the blood. In bronchoasthma or in asthma, there is bronchoconstriction. Bronchoconstriction will reduce oxygen entry into the lungs and retaining more carbon dioxide. And when there's retained carbon dioxide in the blood, it means that if they are going to go into hypoxia, reduce oxygen in the blood. And when there's reduced oxygen in the blood, the individual will experience general hypoxia, mental confusion and all that. So what should be the first thing the nurse should do right here, right now to correct hypoxia? Because that is the highest priority. Number 1, notify the physician. Should that be the first thing you go to do for a patient who's having asthmatic attack, having hypoxia, having reduced oxygen in the blood? Of course not. That will not be an option. So number 1, which is A, is out of the way. Number 2, provide oxygen therapy. Should that be the first thing we do for a patient having hypoxia? Let's hold on to that and move on with the other options. Number 3, have the client breathe into a brown paper bag. Why breathe into a brown paper bag? We know brown paper bag or paper bag rather is used to conserve carbon dioxide. Paper bag is used to conserve carbon dioxide. Now, the individual is having retained carbon dioxide. Are we supposed to retain or conserve carbon dioxide waiting for the individual who is having too much carbon dioxide inside the blood? Of course not. We need to get rid of the carbon dioxide in the blood. So we need more oxygen going in than carbon dioxide be reserved on the outside. So number C, have the client breathe into a brown bag becomes out of the way, because we need to remove or get carbon dioxide that is inside the blood out and not preserving it. Number D says administer azolytic medication. Now, administering azolytic medication will not be an option that will correct hypoxia, because the main problem right here, right now, is hypoxia that need to be corrected. So, the option that we need to do first is to provide oxygen therapy. So, a female client complaining of chest tightness, wheezy respiration, palpitation, shallow respiration are noted. Which of the following priorities should the nurse do first is to provide oxygen therapy. The nurse needs to provide oxygen therapy before notifying the doctor. Among the rules of management is you must do something first. Patient safety, you must, as a nurse, carry out certain action you need to do first before notifying the doctor. If you find this teaching or find these options or this explanation useful, why don't you hit the like button and subscribe to the channel for other things. Thank you. Okay, so welcome back. My name is Mr. Abasa Glory. So let's move straight to number 2 question and then see the rationale behind it. Never forget to subscribe and then hit the notification button. So the question says, an anxious female client complained of chest tightness, tingling sensation, and palpitation, deep, rapid breathing and carpal spasm are noted. Which of the following priority actions should the nurse do first? A, notify the physician. B, provide oxygen therapy. C, have the client breathe into a brown paper bag. And number D says administer azolytic medication. Now, I repeat the question by saying an anxious female client complained of chest tightness, tingling sensation, and palpitation. Deep, rapid breathing and carpal spasm are noted. Which of the following priority actions should the nurse do first? The first question to ask ourselves is, what is the problem with this client? What is the problem with this client? Now, in our previous question, we saw that the patient was having respiratory issues that are narrowed down to asthmatic attack. But here the patient is having tightness of the chest. But before then, the first problem was the patient is anxious. An anxious patient, that's the first complaint, is having tightness, chest tightness, and then tingling sensation and palpitation. Now, in all of this, he is now experiencing deep, rapid breathing. Now, the question is, what is the problem? What is the problem that this patient is facing? Is he facing respiratory problem? Of course not. He's not facing respiratory problem, because we're not told he's having wheezing or having chest pain, any of those symptoms. So what is the problem with this patient? From being anxious to deep, rapid, and then to tingling sensation is signified that the patient is experiencing an ABG problem, arterial blood gas problem. Arterial blood gas problem. And of course, we know that arterial blood gas problem of two main types. We have acidosis and we have acylosis. Now, the patient is having respiratory acylosis. Is having respiratory acylosis. What is respiratory alkalosis, what is respiratory acidosis. Now let's have it at the back of our mind that carbon dioxide is acidic in nature. Carbon dioxide is acidic in nature. So when somebody breathes in and breathes out, where if there is a balance between acid level, oxygen level and carbon dioxide going in and out of the lungs, the individual tends to experience a neutral state. However, if it takes in too much oxygen, such individual will drive out more carbon dioxide. We know carbon dioxide is in the blood and in the lungs. Oxygen is found at the air or at the exterior. So when you breathe in oxygen, and you breathe out carbon dioxide. But when you breathe in too much oxygen, you're going to displace more carbon dioxide, meaning you're going to give out more carbon dioxide. And that will make the blood to become alkaline. Why? Carbon dioxide is acidic in nature. So let's assume during 100-meter race, or during anxiety, or during ventilation, you discover that after 100-meter race, you tend to breathe very fast. You breathe very deep and very fast. What's happening at that point? You are driving in more oxygen so that carbon dioxide can come out from the lungs. What about during anxiety? When you are anxious, you discover that your body cell demand for oxygen become high. Because of that, you want to breathe more so as to drive out the carbon dioxide that is in the blood. Now, what about during hyperventilation? Because of pulmonary resuscitation, you trying to pump in oxygen, administering oxygen. If you administer oxygen too much, you're going to drive out carbon dioxide from the blood. And when you are removing carbon dioxide from the blood, the individual will go into what we call respiratory alkalosis. But let's now assume the individual is having difficulty in breathing, meaning oxygen is not going in enough. When oxygen is not going in enough, just for example, in case of asthma, in asthma we say there is bronchial constriction. Bronchial constriction will lead to reduced oxygen going into the lungs. And when they reduce oxygen going into the lungs, what happens? They're going to be increased carbon dioxide in the blood. So any condition that results in reduced oxygen entering into the lungs, it will result in what we call respiratory acidosis, more carbon dioxide in the blood. And when more carbon dioxide in the blood, the individual are going to have more acid in the blood, respiratory acidosis. Now the question is, it therefore means the individual is anxious and having deep, rapid breathing. So which means that deep, rapid breathing is driving out more carbon dioxide, because more oxygen is being taken in and carbon dioxide is being driven out. When carbon dioxide is being driven out, it's going to be individual to experience respiratory alkalosis. The question is, if a patient is having respiratory alkalosis, too much oxygen going into the lungs, what should the nurse do first? That's the question. A, notify the physician. Should that be the first thing you do when you see the patient is having respiratory alkalosis? Let's hold on to that. Number 2, provide oxygen therapy. Should we administer oxygen to somebody who is having already too much oxygen going into the lungs? Should we administer oxygen to somebody who is having too much oxygen going into his lungs due to the deep, rapid breathing? Let's hold on. C, have the client breathe into a brown paper bag. Why should a patient breathe into a brown paper bag? Let's hold on and move on with the other option. Now, the other option says administer anxiolytic medication. Should we administer anxiolytic medication to calm the individual down? That should be the first thing we do at this point. So analyzing the options, notify the physician, which is number 1, is out of the way. What will you do? You should do something before going to call the doctor. So number 1 is out of the way. Number 2, provide oxygen therapy. Are we to provide oxygen therapy for someone who is already having too much oxygen going into his lungs? Of course not. So number 2 is out of the way, which is B. Number 3, which is C, have the client breathe into a brown paper bag. Why should the patient breathe into a brown paper bag? Let's hold on to that and look at the last option. D, administer anxiolytic medication. Is anxiety more important than what the patient is experiencing? Of course not. So administering anxiolytic medication is out of the way. So the option we are left with is option C. Have the client breathe into a paper bag. Why should a patient breathe into a paper bag? Now, if you look at the option, the patient is having deep, rapid breathing. It means that the patient is bringing out too much carbon dioxide because of that deep, rapid breathing. It therefore means that we need to conserve the carbon dioxide that is coming out, so that the individual can breathe in the carbon dioxide. Just imagine when you are extremely cold. What do? You want to cover your mouth with your hand so that the heat coming from your mouth, you can breathe in the heat again. What that means is you are trying to breathe in carbon dioxide coming out from your lungs. So the individual should breathe into a bag so that as he's taking deep breath, he's going to breathe in the carbon dioxide, because there is reduced carbon dioxide already because of that deep, rapid breathing. So carbon dioxide level is already going down. What do you need? You need to conserve it. How do you conserve it? The patient should breathe into a paper bag, a brown paper bag, so as to conserve the carbon dioxide and breathing in, so as to balance and restore the respiratory alkalosis the individual is experiencing. So the best option to this question is C. Have the client breathe into a brown paper bag. Did you find this question, this rationale useful? Why don't you subscribe and hit the notification bell? Thank you.